Hi everyone, this is Dr. Hamidreza. I'm so excited to have another opportunity to talk about another psychological disorder. Today I'm going to talk about the borderline personality disorder. Borderline personality disorder is associated with different problems related to thinking. These cognitive problems often contribute to other symptoms, including relationship problems, emotional instability, and impulsive behavior. Some treatments for BPD focus on addressing these problems in thinking. The first concern is called paranoid ideation. Most people with BPD experience paranoia as a part of the disorder. They have beliefs that others mean them harm without basis in reality. Most people with BPD who have paranoia experience, they have some transient symptoms that occur under conditions of stress rather than all the time. Chronic paranoid ideation, the long-standing and unchanging delusional beliefs that others plan to harm you, may be indicative of a psychotic disorder, such as a schizophrenia. This can be a debilitating symptom, making the person with BPD feel constantly threatened, even by friends, co-workers, and family members. Another problem is dichotomous thinking. People with BPD also have tendency to think in extremes, a phenomenon called dichotomous or black or white thinking. People with BPD often struggle to see complexity in people and situations and are unable to recognize that things are often not either perfect or horrible, but are something in between. They can lead to splitting, which refers to an inability to maintain a cohesive set of beliefs about oneself and others. Because of these extreme patterns of thinking, people with borderline personality are prone to slip from one side to the opposite side in their thinking. For example, they might one day believe that their partner is the most wonderful, loving person in the world, and the next think that they are evil, hateful, and full of contempt. This can harm the potential to hold lasting interpersonal relationship and how they can interact with others. Another concern is called dissociation. This problematic pattern of thinking that occurs in BPD has less to do with content of thoughts, what people with BPD think about, but rather the process of perception. Dissociation is a common symptom of BPD that involves feeling of unreal, numb, or separate from one's own body or psychological experiences. Again, in most people with BPD, dissociative symptoms tend to occur under the conditions of stress. Some experts believe that dissociation is actually a way of coping with very intensely emotional situations by shutting down or separating one's own experience. This distance can cause people to take more risks and do not feel connected to the situation at hand. And now it's time to elaborate on BPD treatments. Most psychotherapies for BPD include strategies for addressing the problems in thinking that are characteristic of BPD. Some therapies accomplish this indirectly by working on problems in relationships, as in transference-focused therapy, and some try to intervene directly with the thoughts and thinking patterns. For example, in dialectical behavioral therapy, clients are taught grounding skills which can help them to dissociative episodes when they occur. In schema-focused therapy offered by Jeffrey Young, clients learn the origins of their ways of thinking. For example, many people with BPD come from childhood environments that may promote dichotomous thinking patterns and work with their therapist on their own to recognize the maladaptive ways of thinking and to change these patterns. Overall, we can say that the people suffering from BPD have different coping styles in order to tackle the problems. Overcompensation, avoidance, and complete surrender are the strategies taken by the people suffer from borderline personality disorder. And another problem that comes to your mind is that are the borderline personality types can somehow be alleviated or removed by the help of medications? Of course. We can say that sometimes it is treated with medications for anxiety and depression, which may reduce some symptoms of BPD. While there are currently no medication approved by FDA to treat BPD specifically, some drugs have been found to be effective in some cases. They may also be used to treat psychological conditions that frequently co-occur with BPD, such as major depressive disorder. Medications may be particularly effective for BPD when they are used in conjunction with psychotherapy and other treatments. Learning more about different options will help us to find the right medication for these people. Types of BPD medications. There is no medication that specifically treats BPD, but there are several types of medications that may be useful for treating different symptoms. The type of medication that your doctor prescribes will depend on your specific symptoms and needs. First, we can refer to antidepressants. Antidepressants were specifically developed for individuals with major depressive disorder and other disorders characterized by low mood. But many people with BPD are treated with those medications. Antipsychotics are also another medications that can be extremely helpful to tackle and remove and alleviate some of the symptoms of BPD. In addition, mood stabilizers and anticonvulsants are also fantastic drugs. Medication with mood stabilizing properties such as lithium and some anticonvulsant, anti-seizure medications have been used to treat impulsive behavior. Thanks a million for listening to this podcast.